still trying, I think. Still not working? Might have to do subtitles. Get a lip reader to do some interpreting.
It is working. They can hear it.
It is brilliant, fantastic. I hope the countdown was recorded. Okay, welcome everyone. I'm Councillor Matthew Winnington, Cabinet Member for Community Wellbeing, Health and Care, and co-chair of the Health and Wellbeing Boards. Limited public seating has been made available. However, this meeting is also being webcast, as we know, to allow the public to attend remotely if they so wish. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria statue in Guildhall Square. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. May I draw everyone's attention to the fact this meeting will be live streamed. Everyone speaking via a microphone will be on camera, including those making deputations. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please can everyone use their microphones, you can bend them towards you, and remember to turn them off when they have finished speaking, and it's the button on your right, so just on and off when you're speaking. We have read the report, so presenters, please just highlight any developments that have occurred since publication. Before we introduce ourselves, I would like to welcome Councillor Ray Dent, Portsmouth Independent Party Group Representative, and Superintendent Paul Markham, Hampshire Police, who has replaced Superintendent Mark Lewis. Okay, so if we start to my right with introductions.
Anna Martin, Democratic Services.
And Kelly Nash from Strategy Unit, Portsmouth City Council.
Good morning, Natalie Brammer-Pearl, Chief Exec, Portsmouth City Council.
Lorna Reevely, Chief Officer of the Hive Portsmouth.
Roger Batterbury, Chairperson, Health Watch Portsmouth.
Phil Foxton, Hampshire and Isle of Wight Fire and Rescue.
Sarah Daly, Director of Children, Families and Education.
David Goosey, Chair of the Safeguarding Adult Board.
Morning colleagues, Andy Biddle, Director of Adult Social Care for Portsmouth City Council.
Peter Ridley, I'm the Chief Officer of Portsmouth Hospitals here for Penny Emirate.
Hello, Claire Curry, Assistant Director of Public Health, here representing Helen Atkinson, Director of Public Health today.
Peter Whitwood, Probation Service, representing Sarah Beattie, Head of Service, Probation Service.
Frances Soul, Chair of Portsmouth Education Partnership.
Morning all, Councillor Steve Pitt, Leader Portsmouth City Council.
Councillor Raymond Dent, Copner Ward.
Morning everyone, Kate Mullen, Interim Head of Inclusion, Portsmouth City Council.
Mike Stoneman, Deputy Director, Education, Portsmouth City Council.
Thank you everyone, you're very welcome. So we have quite a number of apologies for absence. First we have Councillor Susie Horton, who's in a Department for Education meeting will be joining us later. So we also have Dr Linda Colley, my co-chair. Unfortunately she has COVID. She was going to be chairing this meeting, but you've got me instead, I'm afraid. Councillor Graham Heaney from Labour Group, Bernie Allen from Hampshire Isle of Wight's Integrated Care Board, Sarah Beattie, as we've heard, and Paul Edwards Probation Service, so Peter is here on their behalf. Penny Emirate from Portsmouth Hospitals, James Hill, Director of Housing, Neighbourhood and Building Services, Superintendent Paul Markham from the Police, Gemma Nichols from Portsmouth Creates, Terry Norton from the Deputy Police and Crime Commissioner, Jason Oakley from University of Portsmouth, Joanna Shacklands, City of Portsmouth College, and Diane Sherlock from Age UK. Colleagues, do we have any declarations of interest? as we have a report which refers to integrated care partnership, I have a declaration of interest, non-pecuniary, non-prejudicial, but I work for Action Hampshire. Okay, minutes of previous meeting held on the 6th of March 2024. I don't intend to go through them, and again, assume everyone's read them. Is everyone happy with those? Okay. So matters arising. So both were pertaining to James Hill. For the Homeless Day Service Minute 8 and Positive Relations Conference, as James is not here today, we will get email updates from him on those. So, on to item number 5. So it's different online because it didn't have matters arising. So, item number 5, which is Special Educational Needs and Disability Overview. Sarah, over to you. And welcome, Susie. Any declarations to declare?
No declarations, apologies. Trying to get stuff out of the DFE.
Yes, we'd heard Susie, so thank you. Over to you, Sarah.
And I am going to hand directly over to Mike Stoneman, Deputy Director for Education.
Thank you, Sarah. So what I want to do today is just run through a series of slides, which you'll see in a moment, which is being distributed, with a focus on special education needs and disabilities, which is a hot topic, has been for a while. And if anybody listened to Bridget Phillipson, the new Education Secretary of State, yesterday when she held a seminar for the education workforce, and if you look down the chat, there are about, I think, 3,000 messages in there, and I think about 60–70% were send, which just shows how big an issue this is. And I'll be picking up on some of the challenges that we've got in Portsmouth. I'm here today with Kate Mullen, who's the Interim Head of Inclusion, who is very close to this and leads a lot of this work. So whilst I'll be going through the slides, Kate may well say a few words here and there, and certainly answer any questions that you may have, either after the presentation, or if you've got any questions during it, then please shout. Happy to pick up those as well. So if I just go on to the agenda. So what I wanted to do today was just to show how SEND fits in with the overall Children's Trust structure, where that sits. A bit about our strategy. We've had a 5-year strategy. We're just about to go into a new strategy. I'll talk a bit about that. Preparing for inspection. So we are due to be inspected as a local area by Ofsted and CQC, and I'll talk a little bit about that and how all partners will need to be supporting us in that inspection. A bit about the SENDAP Change Programme, which is quite an exciting programme for us, and it's testing out a number of reforms, and we are leading the South East region, working with 3 other local authorities. Then I'll go on to our strengths, of which there are many, but we have some very significant challenges, just talk through those. And then really finishing on a partnership note, the role of the wider network, our local area approach, and how all partners can support this area of work. So that's the agenda. So if I just go into the first slide, which is the structure, and this will just show you where we sit in terms of SEND. So you've got obviously the Wellbeing Board, Health and Care Portsmouth, sitting underneath that, the Children's Trust Board, of which there are 6 priorities and 2 which underpin that around pre-birth to 5 and the Youth Board. But of those 6, SENDAP is on the right-hand side there, and we are just about to, as I say, refresh that strategy, which I'll come on to in a moment. So that's where we sit within the structure. On the second slide, fourth slide, these are going to be our objectives for the next 5 years. 4 of these are there from the previous strategy, but there are 3 fairly, well, newish ones. They were there, but they're now sitting bold as a key priorities. And very briefly, first one is around meeting children's needs through universal services and what we call ordinarily available provision. So this is the provision that our education settings deliver day in, day out, which can meet the needs of a vast majority of our pupils. Many of those who have SEND, they may not have an education and healthcare plan, but they have SEND needs, and through our ordinarily available provision, the universal provision that is offered by our early years settings, our schools, our colleges, they can meet that need. The second one is around timely and high quality education and support for children with educational healthcare plans. And this also includes the timeliness in terms of doing the assessments that lead up to an EHCP. And I'll come on to one of the challenges around timeliness. The next four we've had before, so developing the workforce, a focus on neurodiversity, a focus on social, emotional and health wellbeing in education, and preparing for adulthood. And then our seventh priority, which fits in with the new approach to SENDAP, the AP being alternative provision. So this is the provision that our settings provide, which is outside of the normal curriculum that will be offered to pupils, which is often needed for a variety of pupils for a variety of reasons to ensure that they progress in education and can access the mainstream curriculum. So if we just move on to the SENDAP Change Programme, I'm not going to go through all the bullet points here, but this is a really important programme for us. As I said before, there are a number of reforms that were proposed by the previous government, which we are testing out at a regional level. And because of the strengths we have in the region, we were chosen to lead the South East on this change programme. And we're working with 3 other local authorities, that's Brighton and Hove, and East and West Sussex County Councils. And you'll see in the bullet points here a number of areas that we are testing. We've appointed a senior manager to lead this work, and we're working across the network to deliver the programme, and of course working with those 3 other local authorities. It does mean for us a significant amount of investment, which is really helpful, and many of these reforms that we are talking about here today are reforms which we believe will help address some of the challenges we face in Portsmouth. As I say, I could spend a long time talking about the programme, but we don't have that time available today. But just to give you sight of that really important piece of work. Preparing for inspection. So this is a joint inspection by Ofsted and CQC. It's based on a local area, so it's not inspecting the local authority or the NHS services or our schools. It's the whole area that is inspected. We were last inspected back in July 2019, and we had a really positive report. We were one of few local authorities that did not get a statement of action, a letter that came from Ofsted and CQC. And we had also a pilot inspection back in 2022, which was effectively trialling the new framework. And again, we came out quite positively against that framework. But we are now due an inspection against that new framework. Most authorities in the South East, I think, have now been inspected. We are one of the few that have yet to be inspected, so we are expecting an inspection any time soon. Thankfully, not before the summer break now. We've passed that point in time, but we may well be inspected during the autumn, but if it's not in the autumn, then certainly in 2025. It's a fairly intensive inspection, lasts 3 weeks, and one of those weeks is on-site. And what we will be doing ahead of that inspection is preparing briefings for our key partners, for our schools, to help with that inspection. It is very much a partnership approach. Yeah, I think that's probably enough, really. Just to mention also, to say that this time round, it's including alternative provision, which is different to previous inspections. And in terms of the outcomes, it's not a judgment as such. There are sort of 3 statements that come out of this. So you can see the 3 there. The first one is around the partnership arrangements typically leading to positive experiences and outcomes for children and young people. The second one is where there are inconsistent experiences and outcomes. And the third one, which is obviously the worst one, where there is widespread or systematic failings leading to significant concerns about the experiences and outcomes. And I think it's important to note those words, experiences and outcomes, because that's one of the fundamental differences with the new framework. Whereas previously, it was very much about are we meeting everything that is expected of us in terms of the code of practice, the reforms that were put in place. This is very much now about experiences and outcomes of our children and young people. And it's fair to say, if you look back at the inspections that have taken place over the last few years under this new framework, many of those outcomes have been in those bottom 2, so the middle one and the last one. There aren't many that have managed to hit that first outcome. That's obviously what we'll be striving for as a partnership, but when I come on to the challenges, you'll see how difficult that may well be. Preparing for inspection, just very briefly, some of the things that we have to do. So we are maintaining our self-evaluation and updating that regularly, and that also is aligned to our new strategy. We're compiling all the documents we need, ready for that inspection, and also setting out all those areas where we know we've got real strengths, what we call time to shine. So the things we are doing exceptionally well, which we're proud of and we want to demonstrate to Ofsted and CQC. We're also looking at the sort of key lines of inquiry that we think they may go down, and preparing our mitigations, our responses to those key lines of inquiry, and that will pick up some of the challenges that I'll talk about later. Also making sure that when Ofsted and CQC ask us for the list of children, we're ready to respond to that. And of course all those briefings that we need to do, the communications, the guidance, getting all that ready, so when we get that call we can issue that to our stakeholders. Right, I'll go on to strengths now, which is probably the best way to start, and then we'll talk about our challenges. And there are so many strengths in Portsmouth, and that's been demonstrated in those inspections that we've had previously, the last one in 2019, but also that one where we were piloting the new framework in 2022. So I think the first point to make is that we've got really strong governance arrangements in the city. We've refreshed our board that oversees this work, we're refreshing our strategy, we've got really strong data, good performance oversight, and that level of partnership working is really strong in the city. So that's always been one of our strengths, and I think will continue to be so. Also around engagement, participation and co-production, we work really closely with our partners, we work really closely with our parents, families, communities, to make sure that they're engaged, they fully participate, and we co-produce many of the work around this. So again, really strong. Early identification and intervention, absolutely critical to this area of work. Again, we've got strong processes in place to identify those children and young people that need that additional support and the interventions that are required to support them. We can also be very proud about our specialist education provision across the city. If we think about the Solent Academies Trust that runs three of our special schools, they're all judged by Ofsted to be outstanding. We have Delta Education Trust that looks after the Harbour School, which I have to say is currently inadequate, but that was down to safeguarding, and they are now on a trajectory to good. They are also responsible for the Wimmering School, which opened 2 years ago, and that will be subject to an Ofsted inspection fairly soon, but all signs are that we've got some really outstanding provision there also. We've done a lot of innovative work around the neurodiversity model and the profiling tool that we have that is being used extensively across our settings, seen as a national innovative project, good practice that we're now sharing across the country. Ordinarily available provision, again, that's a real strength for Portsmouth. All of our settings understand ordinary available provision, how that can be delivered, how it can be used, and we've got superb guidance which supports that work. Again, nationally recognised as good practice. Really strong joint local authority, ICB commissioning arrangements in Portsmouth. And finally, I've flagged their supported internships. So the opportunities that we offer our young people around internships, and we've got some really good examples within the council here, but other examples across the city, and we are further developing that offer for our young people. Coming on to the next set of, well, actually we're now into challenges. So yeah, there are a number of challenges, and this summary provides a snapshot really of where we currently are. So I'll start with attainment and progress. If we look at our children and young people, particularly those who are on SEN support, so they don't have an educational and healthcare plan, but they do have an identified need. If we look at their attainment, their progress, we know we need to do better. And if we compare how our children who are on SEN support are doing compared to, for example, our statistical neighbours to national, that shows there is a gap and we need to improve that. Having said that, if you look at our children who have an educational healthcare plan, progress and attainment is good, particularly when you compare it to those comparators that I've just talked about. School attendance, big issue for us. It's a national issue. We have seen significant improvements in primary now, which is at national or above national. That's really pleasing to see, and we've done a lot of work to support our settings to improve school attendance. But at secondary level, it is still persistently not where we need it to be. We've got too many children and young people, and particularly those who are on SEN support, who are persistently absent, so missing at least 10% of sessions. And we have also a growing number who are severely absent, so below 50%. We're putting a lot of support in place to address that challenge, but it's a big challenge, and it's a national one. The next one, which you will probably hear a bit about, many of our settings, whether they're early year providers, schools, post-16 providers, they are all reporting the difficulties in meeting the needs of SEND children. And that is partly to do with the volume, so the numbers of children we now have in the system, but also the complexity of need has been growing. There are a number of factors behind that, and we could spend probably a whole morning talking about why that is happening, but it is happening. It's a national issue, and we're seeing that played out significantly in Portsmouth. Allied to that is the growth in assessments for education and healthcare plans. So we are seeing a very significant rise in requests for assessments, and I'll show you a graph in a moment to illustrate that. And of course, that is associated with a rise in the children who have educational and healthcare plans. Moving on to other challenges, sufficiency. So this is about providing places for our children with SEND. In mainstream, we can be very proud of how inclusive our schools are. They have always been inclusive, but they are now struggling to meet that demand and provide what is needed for children who either are on SEN support or who have an education healthcare plan. Specialist school places, so our special schools, our inclusion centres, so we have specialist school places in mainstream schools in what we call inclusion centres, where children spend part of their time in an inclusion centre, part of their time in mainstream. We have developed that provision, we have expanded it, and we know we need to do more to increase that provision. At the moment we have 9 inclusion centres, we have 5 special schools, but we're looking to develop that further because of that growing demand. In early years, they are facing significant pressure. We did have a specialist nursery based at Cliffdale. We closed that because we needed the space for our school-age children, and we've tried to put in support across the city with our early years providers so we can cater for that demand in terms of SEND. But the message we're getting back is we need to do more. So we are now considering how we can support our settings, and also considering setting up some specialist hubs across the city to meet the needs of our most complex SEND. And then there's also post-16 places. We are very fortunate that we are able to provide for the majority of our post-16 SEND in this city, working very closely with providers like the City of Portsmouth College, but they are finding it quite challenging. And we know that if we go out of city, the places there are not really available and they are expensive, and it's not good for families in terms of that travel. So we try wherever possible to provide places in the city across all phases, whether that's early years, schools or post-16. Another significant issue for us is funding. So we, as a local authority and as a partnership, have been successful, really, in managing the pressure on the what's called the high needs block. So this is one of our blocks of funding within the Dedicated Schools grant. In most other local authorities, the pressure is intense, and in most authorities, they are operating on a deficit basis. So much so that the government has set up a number of programmes, one called Safety Valve, for those authorities that are in the most difficulty, where they're £1 million into deficit, trying to see if they can get them back onto an even footing. We're not in that position. We've managed it carefully. We've been inclusive. But this year, for the first time in a long time, we're seeing a pressure on our high needs block of about 2.5 million in terms of a forecast deficit. We do have a carry forward, which can protect that. But if that deficit continues to play out over the next 2 or 3 years, then that carry forward will quickly go. So we have started some early work to address that pressure. And that includes investment. We know we can't just stand still. We're going to have to invest. We're going to have to look at more early intervention in order to stem that tide and to reduce that pressure. And then finally on this slide, one which is very close to Kate's heart, is around the timeliness in issuing education and healthcare plans. We have a statutory 20-week timescale to complete the assessment, and where appropriate to issue that plan. And previously, we were at around about 90% in terms of delivering that requirement. We have dropped significantly against that statutory requirement, partly due to that increase in demand that I've just talked about, also around our capacity. We have a recovery plan in place to address that. We've expanded the teams which work to deliver those assessments and write those plans. And we are hopeful that we will get back to where we were 18 months ago. It's going to take probably 2 years, but that's the trajectory we're on at the moment. If I just carry on. So funding pressures, I think I've mentioned most of this already. What I would say is that the requests that we are seeing, if you look across the phases, the majority of those requests are coming from early years and from Key Stage 1, which is something we're looking at in terms of trying to see how we can reduce that pressure. So if we can intervene earlier, provide the support that's needed at the time that need is needed, then that may well then reduce the request for an assessment, and therefore reduce the pressure on the high needs block. So we're looking at that as part of our work. I've shown there a couple of charts, so you can see the growth in the requests for education and healthcare needs assessments, and that steep rise that we've seen over the last few years. And of course, associated with that is those rise in educational healthcare plans as well. And you've got some data there over the last few years, including live data from 2024. Just carrying on in terms of the other slides, I think we're nearly there. Yeah, the second last slide just shows what we currently do to support our mainstream settings. So there is an awful lot of support out there already for our education settings. That includes the ordinary available provision. We've expanded our inclusion outreach service, which we have specialists from our special schools and from our mainstream schools, where we have Senko seconded, who are providing direct support to our settings. We have inclusion capital grants, so we give out small grants to schools, for example, to help them develop spaces for children with SEND. That could be sensory rooms, for example. We have our mental health support teams that many of you will know about. We have full coverage now across the city, providing support to settings. The neurodiversity team, all the innovative work we've done there, working really closely with settings, those ND profiles that I mentioned. We have the multi-agency behavioural support service, a traded services that are offered by the Harbour School. Many of our schools buy into that, as they do our EP education psychology service, a traded service there. We have a vibrant Senko network in the city, which is really important. All of our Senkos from our 63 schools come to that network, pick up all the guidance and the support they need. We have a citywide approach to restorative and relational practice that the majority of our schools are engaged in. LA Link coordinators working with all of our schools, tracking all our vulnerable children and young people, including those on SEND. And that rigorous work we're doing around school attendance across the city, particularly focusing on those children who are severely absent. And we have multi-agency meetings with our secondary schools and some of our primary schools to address that. So there's a lot of support out there, and we'll continue with that and expand it where we can. And then the final slide, which I guess is kind of a message to you really, is the role of the wider network. So that first one, continuation of that first principles approach, so identifying SEND needs as early as possible and to put that support in appropriately so we can meet need and therefore reduce issues further down the line. Identifying shared opportunities, which I think we do really well across the city for all age phases, and what works best for our children, what works best for our parents, and how we can join up those services better. And then the last bit, supporting each other and taking that local area approach as we gear ourselves up for the inspection, which will take place, as I say, either in the autumn this year or next year. So that's a canter through SEND, a really complex and challenging area. And as I say, nationally, probably one of the biggest issues in the education landscape, and for our new Education Secretary of State, this will be right at the top of her agenda. But happy to take any questions.
Thanks very much, Mike. That was a really good and I think very necessary overview of the work on SEND in the city. So opening up to any comments or questions. Lorna.
Yeah, just noting about the capital investment grants that you mentioned, inclusion grants, yeah. Would they be available for community-based nurseries that are providing SEND provision and trying to look at how we can support them to do more of that?
Not at the moment. I can bring Kate in, but at the moment it comes from funding through the DFE, and it is for education settings. So there are restrictions around that funding. At the moment, we are providing funding for our schools, but we are now considering proposals about how we support our early years settings in their communities and how we might be able to provide some capital support there. And I think we'll probably be able to do some of that. But anything else, Kate, on that one?
It's a really timely question because we were talking about this literally this week about how we can pull across some of the good practice we've seen through the inclusion capital grants in schools to early years. And as Mike said, we're not quite there yet in being able to sort of, talk about how that's going to look and feel, but recognise that exactly the same kind of innovative practice that we're seeing in our schools through that process could equally be applied to early years settings to enable them to support children with a variety of SEND needs. So it is something that we are actively considering at the moment.
Thank you. Anyone else? Sarah.
I think I just want to come in. I was at the National DCS conference last week. It felt like last year. And I think, as Mike said yesterday, the significant amount of questions for the new Secretary of State were on SEND. The significant amount of conversation over 3 days was on SEND. Previously, that would have been children's social care. This has absolutely taken over the conversation and the focus of all DCSs. There's a big report coming out in a couple of weeks that will talk more about the system and how broken it is, but it will also set out a number of recommendations about how that system could potentially be fixed. So we are all waiting for that. I think we've seen, just looking at my notes, 140% increase in EHCP requests since the guidance changed back in 2014, and a significant amount of investment, as we've heard. But I think the concerning piece is that despite that investment, outcomes for our children and young people have not got better. They have deteriorated. And I think that's the saddest thing that we continually hear, is we are not making a difference to our children through the work that we're doing and through all the amazing efforts that are made. Our 19-year-olds have got significantly worse outcomes than 10 years ago. So we have to hold a lens up to that broken system. And the word broken system has been quoted back by the Secretary of State. The other call was for the inspections to be frozen and to be held. There is no point in inspecting a system that is broken. It will only tell you your system is broken. So we wait to see and we wait to hear, but that report next week or the week after will be a critical one for all of us in the room, because we are all key partners in this work.
Thanks, Sarah. Susie.
Thank you. It's such a timely thing. So much is going on around SEND at the moment. Everywhere you go, I think what Sarah says, it's the one conversation. In my role, I used to maybe get a phone call or an email from a parent once every few months. Now it's every single day. And I think what it reminds me of is that whilst I'm very much caught up in the discussions around the system and the processes and the funding, that actually people are in a really, really desperate state when they don't know what to do for the best for their children. And I think it's really important that we keep that front and centre when we're really trying to sort of navigate a system which is impossible to be successful in, and that's really difficult for us as well. I mean, coincidentally, there was a notice of motion yesterday at full council from the opposition around this, and it was a very good-natured debate. But what I took away from it was, first of all, the significant amendment that I needed to do in order to make it reflective of what we're doing, which is a message to me around communication. And no one will be surprised to hear me say this, because I bang this drum all the time, is that we have to take people along with us on the journey. And in the absence of sufficient funding, the best thing we've got is relationships. And the relationships are, like, for me, first of all, it's about my job in making sure other members are really updated about what's happening about this. The other thing is around this partnership level. I know we're doing this, so I'm not saying that we're not doing it, because this is exactly what we're doing now, but constantly getting that narrative out there, and also to the wider people in the city, those who are engaged with the services, but actually those who aren't engaged with the services as well, so that when we have cases and things happen, that we're actually people understanding. So I think it's a complex system that we're trying to navigate. Mike and I have just come a thing with the DFE, and there was a woman there talking about how her interest is in the relationship between digital addiction, neurodiversity and outcomes. I kind of got a number because that is really ticking all the boxes for me, because I'm really interested in that. But the reason I chuck that in is that's what we're talking about. We're talking about something that is such a complex system that actually we've got to do our best by it. So I haven't got a question, obviously, but I am proud of a lot of what we do in Portsmouth, and it is the partnership working. But it's really frustrating that despite that, we're in such a complex situation that kind of everyone's failing, and that's not good enough for young people.
Thank you. And thank you for everyone's contributions on this, and thanks, Mike, so much for the presentation. It's as Susie said, it's a hot topic. It's a hot topic in the city, not least with the motion we had yesterday, and obviously we wait with bated breath to see who knows, might be in the King's speech today. It would be good if it was, because it is such an issue right around the country. So, if we move on then to item 6, health and wellbeing strategy performance updates. Over to, I saw Matt arrive. We were going to move this later, but Matt has now arrived, so we can do it in order. To take us through this. Matt, do you just want to introduce yourself as well, as you weren't here when we started?
Thank you, Chair. Find my things. Matt Gummerson, Assistant Director of Public Health, leading on intelligence and research. And here to present you with an update on the public health outcomes framework measures that relate to the health and wellbeing strategy. I'm aware we've got quite a few new faces on this board since that strategy was agreed, so I will just briefly explain the context of that. I will keep the report itself quite short for reasons that will become apparent in terms of the dates that it covers. But really, this is the sort of start of a reporting cycle on this. Hopefully, you've all got a copy of the report and the appendices to look at. So, just as a quick recap, as a board, you agreed a health and wellbeing strategy in 2022 with a long-term focus on the causes of the causes. So, recognising that there are a range of issues that we need to improve on as a city, and that there are some things that kind of underpin positive outcomes across a whole range of those. So a slightly different approach rather than kind of focusing on individual issues and outcomes. And you also agreed a framework for reporting against that strategy. So key to that is a rolling programme of annual updates from each of the priority areas. So the 5 themes within the strategy will each come back to this board each time, and then with development sessions focused in those in more detail as well. We also would do a principles-focused evaluation, which we've built into our health determinants research collaboration work, so you'll hear more about that when that gets going next year. And we said at the time we'd use the Office for National Statistics Health Index, which groups together outcomes across a whole range of indicators as a way of understanding whether our efforts to address the causes of the causes were having a measurable impact on overall well-being in the city. Rather than doing that kind of narrow cause and effect, we did this intervention and this outcome's changed, but we don't really know whether one relates to the other. Unfortunately, the ONS have had to pause the health index due to funding pressures. So we don't know yet whether that's going to be updated again in future years. So what we're doing at the moment is we're tracking progress using the Public Health Outcomes Framework. So that's a nationally published set of outcome measures that cover the kind of whole range of things that we're trying to improve through public health and think that relate closely to the work of this board. The Public Health Outcomes Framework is all publicly available on the Office of Health Improvement website. But what we've done is created a dashboard of the Portsmouth data within that, and within that we've created a subset of those indicators that we think most closely relate to the things that you said are important in your health and wellbeing strategy. And that's what we've used for this report today. So these should provide us with a kind of picture of how the system's doing overall, but also an opportunity to remind yourselves of the kind of key challenges that we face as a system, and also to potentially, if there are new emerging issues that we didn't pick up at the time but that are starting to become more apparent, this will be a chance to flag those up and refresh the strategy accordingly. So for those of you that want to play with the data, if you, on the JSNA homepage, scroll down to the Power BI dashboard at the bottom, there's a filter so you can click just the Health and Wellbeing Board indicators and you can look at the data yourself to your heart's content. What I've done at Appendix A is produced a summary of all of those indicators in one place, but that's also available on there. So for each of those indicators, you've got what the indicator is, the count for Portsmouth, but also the rate for Portsmouth, so you can compare between areas, the trend, so where we're getting better, getting worse, and what's the direction of travel that we want to be aiming in. So is it getting better when it should be, is it going down when it should be going up, effectively? And a spark line that shows kind of the recent trend in that data. So hopefully a reasonable way of glancing at a lot of data in a fairly quick way and seeing those areas that are looking particularly challenging. Overall, the picture is unchanged from where we were the previous year. So 4 of those indicators are getting worse, 4 of them are getting better, and 15 no statistically significant change. And 23 of those indicators are significantly worse than England, with just 5 significantly better. Important to note, while that sounds bad, you chose these indicators because those are the areas that Portsmouth is particularly challenged on. This is not a spectrum of all the measures across Portsmouth. This is a subset of those where we've identified Portsmouth faces particular challenges. So you would expect us to be worse than England on many of those. But this should, over time, give us the chance to see whether we're making a positive difference on those things. You can look at individual indicators in more detail. So in Appendix B, so for each of the indicators in the Public Health Outcomes Framework, there's a button to click on the left-hand side to look in more detail that will then show you the trend for Portsmouth, our comparators, so Portsmouth against England, South East and Southampton, or other statistical neighbours where available, and whether there's significant change over time in any of those. So Appendix B, I've just pulled out one indicator related to each of the 5 themes, just as an example of how that data can be used to understand those in a bit more detail. I'm not going to go through those now. I think the important thing to note is that the challenge with the ONS index and with the Public Health Outcomes Framework is because it's national data, so it needs to be cleansed and then compiled and compared across areas. It's not always the most timely data, so most of what you can see here is from 2022-23, so the things that the board's sponsored and have been done in the name of the Health and Wellbeing Strategy won't have impacted on these measures. So I'm not proposing to go through the actual performance here today. It's more to say this is a framework that we can use over time to keep an eye on these things. What you should see is when you get the individual reports on specific issues, they'll be able to look in a lot more detail at more timely data from the relevant officers and provide the local context around those. So this is a kind of a check-in on an annual basis to say, are we broadly where we should be? Are we seeing the change we want to see? Are there things coming up that we haven't thought about? And that's really what I wanted to say, but obviously happy to take any questions on anything that's in there. And if any of you have got suggestions for ways in which you'd like to receive this information in a different way going forward, then always happy to take those as well.
Thank you very much, Matt. Any comments or questions? No? Okay. Yeah, thanks very much for the update. Obviously, as Matt said, a few new faces. It's something we keep a monitor on as we go. As has been mentioned, this is our strategy through to 2030. So 2 years in, and obviously we have quite an innovative way of doing things in terms of causes of the causes, which is unusual in health and wellbeing strategy, but one that is that has got very positive approaches, and it does show that we've got a lot of work to do across our system, but also it does show the challenges on things that we don't have direct control over, and indeed we have paradoxes in there. So we have high rates of obesity, but we have high rates of physical activity. Work that one out. So it's that's one that always things we have paradoxes right around in the city. We are Pompey in that way. But yeah, thanks a lot for that, Matt. And yeah, if people would like to see things in a different way, do let Matt know and the team, and we can do that. Or if there's anything in particular you'd like to pull out for our next performance update, then let us know. Okay, so moving on to item 7, Violence Against Women and Girls Strategy Development Updates. Caroline Hopper, Corporate Projects Manager, is here to present. Welcome, Caroline.
Oh, good morning, everybody. I'm sorry for the length of the report. I did also make a summary version, but it felt important to share with you the body of work that's taken place to look at a strategy to address these issues, because this is a priority for the health and wellbeing to address violence against women and girls, and it's a journey that we've been on since, I think we started it in 2022, but we had the mandate to developed the strategy last June. So in that time, we've done quite a significant body of work to talk with partners, to hold focus groups across the city with service providers and key stakeholders, but also to talk to our residents about what matters to them and their experience of those behaviours in that full spectrum of those behaviours. And we drew in 800 responses from that public survey, which was quite significant given the nature of the issues being discussed. We're still working through the analysis of that, and I'm expecting to have that this month. We were also able to go and speak with children and young people at the Unlock Student Voice event, and again, that was incredibly insightful into the experience of children and young people in our city who, whilst reassuringly weren't experiencing what we would call those higher harm behaviours, actually those more insidious things around sexism, around actually racism and other discriminations were coming out. So it shows us we still have a journey to go on there. All of that work combined has identified that we will, within this strategy, we will need to be looking at having some really key principles that overarch how we're going to address this spectrum of behaviours. So we're going to be needing to look at our commitment within our city vision around addressing violence against women and girls as being everybody's business. Intrinsically linked to everything we do, not just something that is a community safety issue. Having some agreed ways of working to tackle violence against women and girls that chime really with what we're hearing across a number of other agendas, being relational, being trauma-informed, being restorative, and being systemic in our thinking. We need to do more to work with people who are using unhealthy or abusive behaviours, because at the moment we have got a really decent volume of people identifying as having experienced these behaviours, but actually the number of people who go on to access services to reflect upon their behaviour and to find different ways of behaving actually is relatively small in comparison. And those are just the cases we know about. Those are the kind of where harm has become higher. So actually we've got a lot more work to do to make it safe for people to explore their behaviour and on a continuum. We're also doing this at a time of limited resources. We know that lots of services have been under pressure for some time. We've been doing more for less for a long time. So actually it's really about being smart together and making the best use of what we do have. And we need to do more work to keep listening to those people with lived experiences and checking in with them, because actually what has been evident throughout this is that the same types of messages that we were seeing years ago coming up are still coming up in terms of, for all our best efforts, people are struggling to navigate those systems of support, to reach out, to get help. And actually, what's the worst that can happen? Well, the worst that can happen is we can see people dying, because we've had a number of domestic homicide reviews within the last few years which show us that we need to do better earlier on for all people. In terms of what then sits within that strategy and what we're seeing kind of emerging is some thinking, early thinking has been confirmed, which is that we still need to have some strong pillars of work. The first one we need is around domestic abuse, and as I've said, we've had some real successes around right to ask, right to know, around people raised awareness through our Is This Love campaign around what is healthy and what is not, but actually we still have really low numbers around people engaging in support and being able to have those kind of healthy relationship conversations, and all of our workforce feeling confident to be able to have those discussions, not having to wait for a serious incident to occur to say, should we have a chat about this? In terms of our sexual violence and abuse, actually, there's a relatively small amount of that happens within community settings, but even though it's a small number, it's a big fear for a lot of people, and actually what we need to do is address that fear, because it prevents people from accessing services, support, education, work, the things that can help our city really thrive. So we've got a lot more work to do about making people feel safe out in the community. We've had some early success in the nighttime economy around programmes like the We Stand Together or the Safe Space that operates here in the weekends, but actually we've got more to do across our community venues to make people feel confident. I talked about campaigns like Is This Love? We have other campaigns like the White Ribbon. What we need, and we will address through this strategy, is making sure we've got a continuum of a discussion with our community going on. So we're actually using every touch point we can to have those messages, rather than waiting for a White Ribbon campaign or waiting for our Is This Love, which do have their place and should continue, but actually we need to be weaving these messages into the fabric of our other work. And we need to be doing it in ways that people can hear in the different contexts that they're in. So rather than just assuming that one message will hit everybody, we need to be understanding, particularly in those areas we need to reach into more, how we need to be communicating with those areas of the community. And then we have a piece around putting our own houses in order and making sure that we are the change we want to see in everybody else. Because actually when we look at even this stakeholder group, we have a number of anchor organisations here that actually proportionally, if you add them up, probably employ a reasonable amount of adults in the city. And we have an opportunity through that, rather than just reaching out into our general public, but actually to reach into our own workforces and to look at our own organisational structures and ensure that we're doing everything we can to be the messages that we want to see. And we can do that through a variety of ways. The Council has become a White Ribbon accredited organisation within the last year. That is one avenue that we could be looking to work together across the city to develop. But ultimately that feeling of it starts with us. In terms of the next steps for this strategy, so this is this report was an interim report, so there will be a longer, more detailed document coming out later in the autumn which sets forward the full strategy. We're looking to align that with the publication of the safer accommodation needs assessment, which we do have a statutory duty to publish and have a plan around in the autumn. Alignment also to our community safety strategic assessment review, which again we'll publish in the autumn. So those align quite nicely, and will then give us an opportunity to dig out an action plan after that.
Thank you very much, Caroline. Any comments or questions? Andy?
Thank you. I did, when I started to read the report, I thought, good Lord, that's quite a long one. But actually, I think what it does reflect is the importance that we place on this absolutely key issue in our local society, our local community, and a lot of the work that's been done, so it was well worth the read. I do, and I take the point about anchor institutions. I think that's a really important point because we have got together a huge chunk of the employment in Portsmouth, and I do think there's a lot that we can do. I guess having worked with people over a number of years and having had very active feedback around communication, the key is often the clarity of that communication, I think. You know, it's sort of 2, 3, 4 key messages that we all as anchor institutions could use to support our staff in that sort of making every contact count thing, which I think you alluded to as well, giving people the confidence because they can grasp a few key things that they can make a difference in their own communities, and that seems to me to be really one of the challenges. I also take your point, my wife always tells me change starts with me, and she's right. And so I guess there's that challenge, but I think that clarity of here's something on a slide or on a page, and it's really difficult to reduce all that really good stuff down to it, but that's going to be the key for us, I think, in really making a difference and really getting that message out there that this is completely unacceptable in our society, in our community, in this day and age, and empowering people to feel confident, one, that they know what they're talking about, those key messages, but then two, they know the resources they can tap into if they need to help someone. Just some thoughts. Thank you.
Thank you.
Thanks, Andy. Susie?
Sorry, me again. Caroline's not going to be surprised to hear me mention the word toolkit because, by the way, great report. Really, I loved the way it was sectioned, and I like the kind of the story in it. I think it's really, and there's a little element of optimism as well about what we can do. So there's a couple of phrases that you used. One of them was a continuing discussion with our communities, but I was thinking about, actually, this is about the discussion with the future as well. So for context for other people, we commissioned a piece of work to create a toolkit. We've got quite a good model within the city under the umbrella of Portsmouth Education Partnership where we've developed some toolkits which have actually got national recognition. One is about trans inclusion, there's other ones that we've used. So we commissioned some work around peer-on-peer abuse to try and use the model of the toolkit, which was maybe a familiar way of actually communicating in schools. And that, I understand, you're going to be working on in September to roll that out. It's just about where that fits in here, because I think it is a piece of the jigsaw that needs to have some reference. I thought maybe 10.84, but it might be with the section about the future, because the other phrase that you used was about the change we want to see is actually where better to start than actually in schools. And I'm not talking about even secondary schools. I think we can start talking, it complements the work that we're doing on relational practice so well, but actually it is an area that we know that schools are crying out for professional support with because they don't always feel able to tackle those with confidence, hence the commissioning of the toolkit. So I'm hoping you're going to say that it's going to fit in somewhere to the report.
Oh, yeah, no, it's absolutely. I'd held it back so it could be one of those things that was an early success. Oh, look, we've done something.
I've done a trail for it.
So, yeah, so as you said, we're working towards that publishing in the autumn term. Again, so it's all those ducks are aligning really nicely, and it will very much be part of that effective early intervention and prevention work stream, although we also do see it coming into the organisational change, because what we have reflected on is that we need to also remember that within those schools, there will be staff who are also affected by these issues. So actually what we absolutely need to make sure is that we're not handing staff something to deliver against without making sure that they have got the sufficient support to have the full capacity to work with our young people. particularly in a context of education where they're under so much pressure already. But yeah, we do see it sitting across, but the primary location for it, prevention and early intervention.
Thanks, Caroline. Just a question. I know it's mentioned in the report, but I think it might be useful to, just for clarification, it's called the Violence Against Women and Girls Strategy, but it also is about these things that are in the strategy that affect men and boys.
Yeah, absolutely. So we have taken our lead nationally in terms of the terminology around this, and we followed the National Police Chief Council's definition in terms of the behaviours that we're looking to explore. But within all of that, and within the previous government's setting out statement, they said this is about anybody affected by those behaviours. Now, we have something to think about is, do we put out a strategy that is called addressing violence against women and girls, and then need to put something out that clarifies that, or do we put out a strategy that is named differently and then put a statement within that about the need for a gendered lens, because we do understand it does disproportionately affect women and girls, and we need to be cognizant to that in order to address it effectively. So that is still something that we're working through, but yeah, it is irrespective of gender.
Thank you, and I just think it was worth just pulling out in that context, because as you said, it's a accepted definition, and if it is changed, that will have to be on the with co-producing it, because it has to be done with partners who are involved in this across the city. I'd just like to say thank you for this report. Looking forward to the full report when it comes later in the year, but it's really thorough, and as Susie said, with some real positives in there about the things we can actually take steps to do, and obviously within what we do as people around this table, but also the rest of the city as well. So really appreciate the report, and thanks so much for presenting today. So on to item 8, integrated care partnerships, social connectedness priority. Over to Claire.
Thank you very much, Chair. So, as you know, the Hampshire Isle of Wight Integrated Care Partnership priority, of which social connectedness is one of the priorities, is set out in the Integrated Care System strategy set in 2022, and many of you in this room will have been involved in the extensive stakeholder consultation which set that strategy. So that's a sort of medium-term strategy, perhaps 5 years, and this update broadly reflects the first year of work in this priority area. Of course, for the Portsmouth Health and Wellbeing Board, this is particularly of interest, perhaps, in how it seeks to complement the work of the positive relationships priority within our strategy. Helen Atkinson, Director of Public Health here in Portsmouth, is the Senior Responsible Officer leading this priority across the ICP, and I'm supporting her with that work. However, this work has absolutely been taken forward in a shared partnership with the community and voluntary sector, recognising their vital role in this space, and also recognising that actually so much work is already happening within our communities, which is making a real difference to lives of local residents. So Hive Portsmouth are part of that oversight group for the work. So in this programme, partners are playing a role seeking to meaningfully connect people to improve a sense of belonging, whether that's family, friends, neighbours and communities. And within that, we're advocating an asset-based community development approach, which is focused on how we work alongside communities, that communities can work on their own solutions and that the health and care system supports individuals and communities where that's needed. We believe this is important because it has benefits, of course, to both physical and mental health and wellbeing, and knowing that some groups in our community experience a lack of social connection to a greater extent than others. So for Portsmouth, this work has been an opportunity to share a real light on the asset work already going on in Paulsgrove and Portsea, as well as building explicit reference to social connectedness into several areas of work, so as an outcome which is valued in itself. We've played our role in participating in Loneliness Awareness Week, which is a national awareness week, and for which the theme was random acts of connection. And we're also looking forward to a Connecting the Connected event, which will be in Victoria Park in the coming months. And the purpose of that is twofold. One, to grow a sense of shared understanding and indeed connection between services in the city who have roles in this space, but also then to reach our local residents to ensure that they are aware of the support and services available. The Hampshire Isle of Wight work has sought to develop a shared understanding of social connectedness across that wider geography, and also advocate, again, for that asset-based approach as a valued measure. An assembly was held in February, which again showcased Portsmouth through a variety of stands, but also through a powerful and inspiring story shared by Father Bob White talking about Fratton Big Local, which was really fabulous to hear. The other more notable activity has been a recent Sandpit event, so as a collaboration between the NIHR Applied Research Collaboration, which is ARC Wessex, and they've got a healthy communities theme, so it made absolute sense to connect with that research strand of work. The outcome of that sandpit was to identify a small number of research seeds which could be aligned as useful areas to further research, align to practice, and with the potential that could inform longer-term research priorities. So this work is aiming to celebrate and share good practice already happening in our communities, underpin our work with expertise from academic partners, and to build explicit reference to social connectedness across areas of work. Partners of this board, again, in a similar way to what Caroline has asked really, is to think about how they can support this work as either employers or indeed how they work with local residents. Happy to answer any questions.
Thank you very much, Claire. Any comments or questions? I think obviously, as it's mentioned there, and myself and Andy sit on the Integrated Care Partnership Joint Committee, and the assembly that we had in February in Southampton was excellent, and Father Bob was a star, as Father Bob often is. But telling that story about the work in Fratton, and that was it got a fantastic response from across the Integrated Care Partnership who were there from right across Hampshire, Isle of Wight. I think we have a really good story to tell in Portsmouth, and the work that's going on. I think it's mentioned here about the event that's going to go on in Victoria Park in August, and also looking at an event in Paulsgrove as well. So that working we're doing specifically in Paulsgrove and Portsea at the moment, which is really just have social connectedness at the heart, and also the learning we can take from that going forwards as well into other areas of the city. And sometimes the things that we do, we like to pilot in our sort of more economically deprived areas of the city, but they are things that we can use right across the city. I having worked with people as a support worker and managing a team of people, supporting people with dementia and their carers in the past, the thing you get is that there are so many people who are isolated in places you don't think people would be isolated in, people who maybe have lots of assets but maybe don't know their neighbours or don't have those connections anymore, especially older people who don't have loved ones with them anymore, or on their own and single. So there's so much we can learn and really take forwards on that. So there are some recommendations on this report, and actually I think they're really indicative of what Claire has presented and the work that's going on. So so we are asked to note the activity underway in the city to promote social connectedness, consider opportunities for this work to further complement the positive relationships priority for the city, and consider examples or approaches which members of the Health and Wellbeing Board can contribute in their efforts to promote social connectedness through their roles as employers or in delivering services to local residents. So is everyone happy with those recommendations? Fantastic. And do please, if you have any ideas on what to do, then speak to each other, because we can share and we can make a difference. Okay, brilliant. So, Roger, on to you. It's now the Healthwatch Portsmouth Health Inequalities Research Findings. Roger, the Healthwatch Portsmouth, over to you.
Thank you, Chair. We've got some paperwork coming round. Thank you for distributing that. So I'll let you look through these slides that we've prepared, and I shall do some reading whilst you browse through. Happy to answer any questions afterwards, and I'll talk about the next steps. So this is a project on health inequalities funded by Healthwatch Portsmouth and in partnership with the University of Portsmouth. So the project sought to explore the experiences and unmet needs of individuals living in deprived areas of Portsmouth with regard to access to health services, education, housing, good quality employment, support networks and social arrangements. Whilst the Health and Wellbeing Strategy for Portsmouth 22 to 30 aims to make Portsmouth a healthier and happier city, several areas of Portsmouth are some of the most deprived areas in the country. Those living in the more deprived areas or experiencing health inequalities are more likely to live more of their lives in poorer health and experience low life expectancy and productivity. Conversations were undertaken with people living in postcodes PO1 to PO6 and with those who work with people living in these areas. Challenges were identified in all of the following areas: access to healthcare, support networks, housing, education and employment. A further additional area of concern, access to health and education for children with special educational needs or disabilities, was also identified, which is interesting because that was a topic earlier with SEND. A number of solutions are presented, informed by the discussions with local residents. Key to these is ensuring that people are placed at the heart of services in Portsmouth and that their views are sought and acted upon. This includes more joined-up thinking by services, enabling access in ways which suit different groups, including those who are unable to access or use online mechanisms, and more information about the services available and how these can be accessed. It is recommended that existing good practice, particularly support provided through community groups and centres, forms the foundation for future changes. So that's the overview from the summary report, which you will be sent after the meeting, and also the full report and the slides, if need be. So I'll let you still read through the slides. I'm not a great one for talking to the slides, particularly unless they're up on a screen. So the next steps, we're hoping that a future Health and Wellbeing Board development session in the autumn, that Siobhan, the Healthwatch Area Director, will come along with the University of Portsmouth project lead. And what we'll be thinking of is now, so that will be a discussion, but we are looking at asking the communities how to achieve the solutions that were offered by residents to the problems. And Healthwatch would like to ask those that attend the Health and Wellbeing Board development session how to get to that sort of next step of the work and taking ownership of these key options recommended by communities to achieve the solutions sought by communities. We are taking the report to the Hampshire and Isle of Wight Integrated Care Board Joint Committee on the 9th of October, but that will be looking at it from a wider ICS geography. And Siobhan will be working on that with the Healthwatch colleagues across the Hampshire and Isle of Wight patch. So you'll see in the slides that there are some obvious issues that have come up with dentistry, access to primary care, booking appointments, of course, getting to A&E, access to education, and some of the solutions are listed in there. I think are very optimistic, more NHS dental appointment slots, but we can but dream. As we're in a dental desert, as I keep being told. Next item on the agenda, I think. So lots of solutions. So it's kind of an ongoing piece of work, and we're happy to take any steer that people have. So I won't take up more time, Matt.
Thank you, Roger. Comments or questions? Steve.
Thanks, Matt. Roger, you've got listed under the solutions an item about affordable school trips and holiday clubs. Was there an awareness, or how great was the awareness during the research piece about the HAF provision?
I don't think it was done necessarily with lots of prior knowledge. This was comments coming from the community, so it might just be someone wasn't aware, Steve, about that. So point taken, though.
But it is telling us that we need to make sure that everyone knows it's there, because it's really good.
Yeah. Yeah.
Thanks, Roger.
Yeah, thank you.
Any others? Susie.
It's just an additional thing to that. I think it's a really good thing to raise, because I think there is extensive knowledge about HAF, but if you don't know, you don't know. And I wonder also whether, for some of these people, if children are not in school much, and we use school as the mechanism for communicating most things, we've talked about attendance, you might miss out, or digital exclusion if schools are sending stuff out through e-bulletins or whatever, and you're not. If you're not in the system, you're not in the system. And I think it may, I mean, I'm not trying to create a kind of cause and effect thing, but it could be. So many of the things we've brought up today about if you're isolated in the first place and you're not digitally engaged and you're kind of disconnected, then you're actually at more of a disadvantage. But I do think it's a good takeaway about how do we get that information out there. And actually the HAF stuff, Steve, coming back to your point, is mainly you have to book through a website, so we need to look and make sure that that's there are other methods.
Yes.
Hi, now I haven't met many of you. So I'm Peter Ridley, Chief Officer at Portsmouth Hospitals. I was going to come in on a similar point. This accessible information options offered beyond online channels feels really important, doesn't it? And because that is always our default, isn't it? I see that in my organisation, I see it elsewhere. I've worked in the NHS, and it feels like it's something we could work on together. And you can only work on it together by talking to the community again about how we do that and actually what would work, wouldn't it? So when I think about opening our new emergency department and things like that, actually we'll spend an awful lot of time about press releases we'll do online and what have you, but actually how do we have the right conversation with the community about what that department is, how it should be accessed, how things are changing. So I'd be really interested in a conversation about how do we get the right input into this and how do we learn from this and work together.
Okay, that sounds excellent. Yeah, we'll obviously be working with partners on the next stage, and we've just published a report on accessible information. So.
Thanks, Peter. We've got Andy and then Claire.
Thank you. Thanks, Roger. I suppose, firstly, congratulations, because we wrap ourselves up so much in so much verbiage that we're not entirely sure what we've agreed to or what we've done. And this is really clear and to the point, and it frames how residents do tell us, do give us feedback. So I think it's really valuable stuff. I guess the other point is linked to that communication thing. We know in Portsmouth, for instance, that we've offered, I don't remember the number, but so many more primary care appointments than we used to. And we've been trying to work towards enabling people to access those services and not to end up at the big white building on the hill, because we know that's not the best solution for a lot of folk. But we clearly haven't communicated it well, because even if there are appointments available, the perception is still that there aren't. And we know that perceptions drive a lot of behaviour. So it comes back to, for me, I think, to that really clear comms and that really clear engagement. So there's this stuff available. Here's how we tell you about it, and here's how we have a regular interface that says, well, if you can't access it, why not? So is there a more nuanced bit about how we do this? And that talks to the electronic communication, the paper communication, whatever it is, and all that stuff. But it's it's that enabling people to make those right choices as well. And we clearly haven't got it quite right from some of this feedback, but it's really useful to hear this feedback in those very clear terms. Thank you.
Claire.
Thank you. Just to reiterate the same point as Andy, but what a fantastic piece of work in terms of listening to people in our communities. And I'm really happy to support where I can in terms of connecting that to other things that might be going on, because I think, you know, with all of these things, it's so important that we do listen and, you know, evidence to, you know, to build trust really with our communities, that we have listened. And, you know, some things we can take forward and obviously some things might be more tricky. Just to, I suppose, highlight a few good things that, you know, I think have been perhaps sort of fed back, you know, as an example, you know, local community centres serving as information hubs and community centres offering multiple venues. I mean, our Live Well events, what a great example of how we are starting to do some of that stuff in the city. So I think it is also reinforcing some of the direction that we are going in with that. And just to highlight a couple of other bits which we can pick up perhaps outside, but again, as part of the Hampshire Isle of Wight Integrated Care Partnership work, they had their digital theme had an assembly a couple of weeks or so ago now, and through that they are doing a survey to understand that digital inclusion aspect. I know that's being distributed, yes, online, but also in paper format to a range of places, including libraries and other places in Portsmouth. And I think that does provide an opportunity for how we can perhaps further understand what our communities are saying about some of these things, which hopefully will provide useful insights for us in Portsmouth. So perhaps opportunities to link into some of those things. And also just to highlight the new role there is in Portsmouth, the health and employment role, which again is a Hampshire Isle of Wight role, funded through external funding through the ICB, but actually hosted in the Portsmouth City Council Employment and Skills Directorate, thinking about that link for people getting into employment, and what you've noted in the report here about the disability part of that. You know, I think all that learning and findings is really great, just to make sure that that person, you know, and that post holder who started this week, Sue, I'm sure you'll all meet her in time, is aware of, so I'll make sure she receives that.
Steve and then Lorna.
Thanks, Matt. As some people in the room will know, I've had rather more engagement with primary healthcare over the last few months than I might have wanted to, and certainly more than I had for many years. And a couple of these things on here really do resonate quite strongly with me. If you're at work and you are needing to speak to a healthcare professional, being told that someone will call you between 9 and 12 or 12 and 4 is as much use as a chocolate teapot, because people can't afford to take half a day off to make themselves available for when the phone actually does ring. And by the way, it doesn't ring within the hours of the slot they gave you anyway. But there is inconsistency of that across different GPs practices. So I'm not going to name any names, but I had to leave one practice and go to another one, and the experience between the two was literally chalk and cheese. And that should not be happening. We should have consistency across the piece. And there are more appointments available, but try getting past the gatekeepers on the reception desks who have not got that message, and you have to fight tooth and nail to actually get them to agree to give you an appointment. Then they tell you there's one available the following day. But the message you get is that you're a nuisance, and that's coming from some GP practices in this city. And this is just a bit of a shot across the bows for anybody who might listen in on this. I'm going to make a lot of noise about this over the rest of this year. Not because it's me, because I'm able to go out and fight my corner and have the wherewithal to switch practices, to go and get the money to go get a private appointment when I'm being denied it elsewhere. But there's thousands of people in this city who don't. And it's unacceptable. And this is not about money. It's about poor practice and a lack of health and care, where it should be at the coalface directed to the patients. People are lying on their beds right now in agony because they've been abandoned by their GPs. So I have huge respect for people who work in the medical profession, but I have the most respect for the people who actually remain patient-focused and not who are focused just on the system. So, Roger, if there's anything I can do to help you, I've got a very big story to tell, and I'm going to be telling it.
Okay, we'll catch up soon. I'm sorry to hear about your experience, but it's not unfamiliar, I'm afraid. Thank you.
Lorna.
Yeah, I just wanted to pick up the points that are raised around accessible taxis and transport in the city and disabled employment, because the Disability Advisory Group in the city, those are two of their priorities. The third one is about access to healthcare. So I think that if you haven't already spoken to them, it would be a really good link in terms of the work they're already doing and the work that the council or the cross-party working group is doing, particularly around accessible transport in the city. It is a huge issue.
Thanks, Lorna, and thank you, Roger, for the report. And I echo the obviously Steve's experience, which is not unusual, and myself and Susie and others have been obviously trying to work on this for some time. But any personal experience is always going to be really helpful going forwards. I was just going to pick out the bit about employment, because this is one that I think is often gets forgotten about in terms of people being in employment who have disabilities and also looking to get employment. And that's something that this year as an administration, for example, we are making, and this is a bit of a passion piece for myself, about having lived experiences being a key part of employment and actually being a real positive for employment rather than being something that you have to hide away. I always use as an example, when I worked for Solent Mines, I had a colleague who did a bit of a testimony. They were at an event and did a bit of a testimony, and he said, I have never worked somewhere where my mental health condition is a positive rather than being something I feel I have to hide. And that should be something that in employment, when people are going into jobs right across this city, that actually if they're working, say, in housing at the council, if they say I have experience of being homeless, that's a positive. That's something you can use in experience. Or if you're wanting to work in the hospital and you've got some experience of having huge amounts of time at hospital, and that's a positive, because it means you have more empathy and you have understanding of how systems work. So it's something that I think obviously we want to work on at the council and make that as something that's positive, of lived experience, no matter what your background is, but also across us as the Health and Wellbeing Board and across the city, is actually people having lived experience of whatever it is in the field they're going in, and also that actually having a mental health issue and you're going to want to work in a business environment means you've got that experience you can share with others and give more awareness, so that when colleagues have maybe mental health issues that you're working with, you can actually help the management, you can help that colleague and everything. It's a real positive. So one of those things, I think, in the employment side, I think that really ties in with what's come out. And I think we should always take notice of reports like this, because this is from the people who live in this city. And as says at the start as well, we've also got the 6 people working in communities, so they will have, it's not just those 6 people, it's the people that they're dealing with, that they are having that feedback from as well, and we should really take note. Really good stuff in there, and yeah, let's make this work, and let's have it so that the next time this is done, whenever that might be, people aren't having this kind of feedback. But also, and this is tying with what Steve says, and what's been mentioned about dentistry, which we're going to come to in a minute, and other things like that, is that this also gives us more power to then go up the line and talk to people at a regional and national level, saying, this is what people in Portsmouth are saying, this is what the issues are, how can you help us make sure that that these are addressed? Because if we don't get support from outside, we're never going to solve a lot of these things, because we don't have the power to do so. We have the power to give a voice, but we don't have the power to do them ourselves, especially when it's things that depend on national funding and national ways of doing things. So thanks so much, Roger. and on behalf of the Health and Wellbeing Board, we really appreciate the report today. Okay, speaking of dentistry, item 10, dentistry in Portsmouth updates. So I think Simon is going to join us, who's Director of Pharmacy, Optometry and Dentistry at NHS Hampshire Isle of Wight. Over to you.
Thank you very much, Chair. I won't regurgitate what we have in the file. I'm sure there will be plenty of questions on dentistry. But I will just highlight some of the context in which we have to commission dentistry across the whole of the ICB that may not be immediately apparent from the paper that you've got. Oh, glasses are going to have to go on. Check my notes. So first off, I need to make you aware that patients do not register, that's my background as a pharmacist, residents do not register with a dentist in the same way as they do with a GP. So I will get, and I'm sure some of you will have had letters from residents within Portsmouth saying that their dentist has deregistered them or such wording. I have to write back when I get those complaints with a disheartening letter for me and for the person involved that you were never registered with a dentist in the first place. They are only required within the contract to welcome to my world. Yeah, so they are only required. The dentist is only required to see you for that course of treatment. At the end of that course of treatment, whatever that is, that's where their relationship with that person ends theoretically. Now, as good business sense, dentists do hold a regular list of patients that they will call in for regular checkups, etc. But they are not bound to do that. So we don't have a set list, whereas we would with GP practices. If a GP practice handed back its contract and decided to say goodbye to NHS, we would have to find homes for those patients. There is no requirement for us to do that within dentistry. So with that in mind, we'll move on to what is a course of treatment. So within the paper there, we reimburse dentists by what's called a UDA, which is Unit of Dental Activity. Roger's nodding all the way through this. We've had these discussions through the... so Unit of Dental Activity is effectively the tariff by which we reimburse dentists. So for a checkup, that's one UDA. For several fillings, it will be 2 or 3 UDAs, up to a quite high level of 13 UDAs for some quite heavy involved treatment, which seems entirely fair. However, if you go and see your dentist for a checkup and they then identify that you might perhaps need a couple of fillings, and then subsequently you need some more involved work around a bridge or some more dental work, they will only get reimbursed for the banding that you get to. So you get reimbursed for the highest banding. So I liken this to going to the mechanic and getting a service for your car and them saying you need a couple of new tyres and you need your gearbox changing, and you saying to the mechanic, but I'm only going to pay you for the gearbox because that's the most important part. That's how we currently reimburse dentists within the contract. The UDA rate that we reimburse dentists is not a standard rate. Every dentist can be paid a different rate. We will have dentists within the city within a few hundred yards of each other being paid a different rate for doing effectively the same treatments to patients. So that's the gift that was given to me when the ICB took on dentistry 2 years ago. So when we start to think about how we change these things, and I've sat in a variety of public meetings, and I did say at the very first point, it's not in my gift currently to flick a switch and make dentistry better. I need to stop it getting worse, I need to stabilise it, and then I can start to make it better. The latest data we have is starting to show increasing number of patients being able to see dentists. When I look at the last 12 months rates for patients who have seen residents who have seen a dentist within Portsmouth, both children and adults are increasing. It's not jumping up hand over fist, and I will still get patients who are struggling to find a dentist, an NHS dentist. But it is starting to move in the right direction. We were innovative in our use of mobile dental units, and I'm sure you'll all have seen the Dentaid bus either in the media, or you may have even seen it within Portsmouth attending. So we've had, between February and June this year, you've had 51 visits from the Dentaid bus who are targeting the most vulnerable in society. So they're working, Dentaid are a charity, they have really good links with the third sector, and are working with food banks and working with homeless shelters, etc., to identify those patients. And they're giving treatments to those that otherwise would never be able to see anybody. So we're doing the best we can. We've had to contract that in a slightly different way to bring that in, but it's something that we could do, and we could do very quickly within Hampshire and Isle of Wight, and we've done that at scale. NHS in England are very interested in how we take that forward. Also, just be mindful that my biggest challenge, despite what I've just said, is the dental workforce. We've got a dental academy within Portsmouth. We would very much like that to become a school of dentistry and bring that forward. Having done my background as a pharmacist and done my degree in the School of Pharmacy in Portsmouth, I would love to see a school of dentistry. Now I'm wandering into dentistry. I think that would be brilliant for the city. But as another eye-opener, when I take a lid off a can of worms within dentistry, the day you qualify as a dentist, you can work in the private sector. If you want to work for the NHS, you have to do a foundation year to qualify. So there are some challenges in that respect. Now, some of the good news is that we had something called the Big Dental Discussion some time ago, and Roger was there when we went there. I was really reassured that dentists value the NHS as a way of working. They want to work in the NHS, and they want to actually provide that part of that NHS family dental care. It's how we get them there and how we get them to do it. So we are engaging with lots of individual contractors. I'm being approached individually by contractors to say, I want to make it better. Can we do this? Can we do that? So we are engaging, and we're starting to take things forward. One of the things that we did do that may not be immediately apparent is we've started to stabilise the provision on the Isle of Wight, because we know patients will be travelling from the Isle of Wight, will either be coming to Portsmouth or Southampton, and then taking up, inverted commas, your capacity. So we're starting to stabilise that. Their rates are going up in terms of the patients who are being seen on the island. Your rates are starting to be going up with your residents that are being seen by dentists, so we're starting to see some positive noise. But it is a challenging environment. So what might be a simple ask to increase the number of dentists, actually when you start to lift the lid off some of these things, is becoming a little bit more challenging. I'll probably leave it there. I'm sure there'll be a few questions around that. I'm happy to take any questions for.
Thank you, Simon. Any comments or questions? Steve, go on. Reaching for it.
As everyone knows, illogical things are the things that absolutely set me on fire. And the very idea that you can go and work as a private dentist the day after you qualify, but you've got to do a year with the NHS, what a ridiculous disconnect. And what a ridiculous disconnect that we're treating dental health differently to other forms of physical health. That just makes absolutely no sense whatsoever. And it just goes to show, I'm not going to be party political here, but I am going to be political, systemic failure of government for 80 years. That some very clever people got together in the 1940s and set up the NHS. And it's almost sometimes feels like ever since then, nothing's happened on the key things that were decisions made for the right reasons at the time, on some really fundamental points. But also that everyone else that's interfered with it ever since has just made it flipping worse. So it's great to get some positive feedback on these things today, but I'm pretty sure that most people in the room didn't know they didn't have a dentist. And that's an extraordinary thing, and something that, well, clearly you've learned along the way as well. But we've got to be able to do more. I mean, I am also hearing that people are finding it possible to now get a dental appointment. But we don't want to end up with a situation where, because the current crisis is exacerbating that lack of formal link, that we've got people every time something goes wrong with their dental health that they're going to have to. We just had a report from Health Watch talking about the fact that people have to keep re-explaining their condition and their situation to new people each time. If people are having a shop round like it's some kind of Middle Eastern bazaar to go and find the thing that they need each time, then they're having to continually re-explain their condition, I'm one of those people, I've got over it now, but when I was younger, I used to have horrendous fear of dentists. In fact, I didn't go to a dentist for 27 years because I was terrified of dental work. I've got over that, I fixed it, I go very regularly. But for those people who do struggle, and I'm very lucky to be with a dentist who absolutely gets that and is very sympathetic in how he treats me because of it, and that's what's helped me to go over it. If you are somebody with anxiety, the very idea that every single time you've had a course of treatment, you've got to go and start that process all over again with somebody else because you've had your course of treatment, these are fundamental issues that are undermining patient care. So we've got to get to grips with these things. So my question is, to what extent do you feel, through the work that you're doing locally, that you are connected properly up the chain, and are you having similar conversations with your equivalents in other areas to try and get a head of steam together here to try and make the case to government nationally?
Yes. To say it's been a steep learning curve is probably beyond the... Day two, I was asked to attend the Health Select Committee in the Houses of Parliament. So, I mean, from being a pharmacist to you taking on community pharmacy to day two, you're going to the House of Parliament to explain, was a challenging step. And some of the... So I attended there with Joe York, my predecessor within this space, within the pod space. And some of the elements that's come out within dental reform since that date resonate with what we said on that day. Whether it was us that fed into that or not, I'm not aware, but we did reaffirm those beliefs if we weren't the first people to say them. I'm also closely linked with the Chief Dental Officer and starting to work with him around improving the dental aspect, the digital aspects of dental healthcare. So you may not be aware that we did a huge amount of work within Portsmouth when I was the Director of Medicines Optimisation around being the first CCG to become electronic prescribing, which allows prescriptions to go efficiently and quickly without people wandering around with a piece of paper. Currently, dentists have to handwrite every prescription. I can see your pen's going to hit the desk again in a minute. There are some challenges in that, and there needs to be some primary legislation change around the legislative aspects. But it's another example of how we are looking to engage widely, engage quite senior, high up the league table of where we can actually impact on these things. We are pushing. I have very good relationships, and this morning was having an email discussion with my equivalents across the whole of the South East region. We are aligned in what we want to do. We might have some differences in how we want to do that, but we are all very much trying to push up and influence up through the NHS and externally through groups such as this. And I'm back here tomorrow for HOSP to actually reinforce the same messages. So I apologise if you're there as well. I might bore you with the same challenges. But actually, I need to keep saying these things to actually get that message through. That actually, whilst I'm not one to go and beat somebody over the head for an action that they've done if I don't understand why they've done it, because there might be things that are unknown to me. But I will go and ask the question as to why it's been done that way and why has it appeared that way.
Natalie.
Thank you. Well, firstly, my daughter's in her 4th year of dentistry, clearly not in Portsmouth, but I do get the other end of it, which is really interesting because where she is, which is Bristol, they absolutely encourage everybody to go into the NHS. So she's looking at what happens after the 5th year. So yes, you can just go and do aesthetics, which is the big thing, and that's where all the dentists are going because that's where they make all the money. But they're actually encouraging everybody to go into the NHS because that's where you get your that's where you get your exposure of different patients. Whereas if you're going straight into a private practice, you just don't get that. And obviously we need more people to go into the NHS, whether or not it's in a hospital setting or in an NHS dental setting. And so that very much is the push. And that's what I think, you know, if we do get a dental school here, brilliant, that's exactly the message we should be encouraging as well. So we can try and create the pipeline of young talent coming through the system, that the immediate thing is not to go and look at I could make, you know, £1,000 an hour doing some aesthetics and some Botox injections. That's what a lot of them seem to be doing at the moment. But that's also the reps that go into dental schools, which are selling all of this. So they are at a very young age almost being kind of swayed by where you can make your money. And dentistry, I think, is something that you can go on as a vocational thing, but also people take that choice as a possible way of making a lot of money. And I think you see that in lots of places around the country. The other thing I was going to say is that when she was looking at her options, what was really, really clear about where she studied dentistry, there's only 12 dentistry schools in the whole of the UK, including Cardiff and Dundee and Edinburgh. There are really few places, 12, and I think there's about 42 medical schools. So that's why we don't have a pipeline of people coming through. But what was really interesting is that when she had a look at Cardiff were offering any student who did their dentistry degrees with them their fees paid if they stayed in the NHS system in Cardiff for 2 years. So again, that was a way of retaining them and that talent in the system and not seeing the bright lights. We don't do that in England, we don't do that in Scotland, but it was the Welsh system that actually proactively encouraged you to stay in the system. So I think it goes all the way back to actually how do we get upstream with some of this? If it's a problem we know we have to solve now, but it's a problem we have to solve going forward. And just that wider point really around, obviously dentistry is a health issue, so you check for mouth cancers, you will go, you'll get your neck felt, you'll get lumps, everything else checked. There's infections, there's relationships to kind of heart problems and other blood infections. They are health issues. It shouldn't be a kind of, if you can afford it, I'll get onto a dentist list to access healthcare. So there is definitely something that I think, whether it's through this forum or through other forums, that we should actually be doing to get the message out. Because I know people have phobias about dentists, but there's a lot more that they do than just look at your teeth. They pick up other things. And if you think about preventative stuff, that by the time if you don't go and you've got some form of mouth cancer, that pressure on the NHS is huge in terms of recovery, in terms of beds and everything else. So we just need to get up front with it and upstream about it. But it just goes to show that there are places that do things slightly differently, not too far away from us. I just wanted to share that because, again, we've talked about learning, but there are other places that do things differently.
I'm very up for doing things differently. I think we've gone on too long perhaps doing the same thing, and I think that's one of the benefits of it coming to the ICBs, is that we can actually focus on what our residents want, what they need, where we need to put that, and then hopefully, because as it stands, residents do travel. I will just pick me up every time I say it. So people will travel some quite large distances to attend an NHS dentist. So what I need to get a real handle on is if I was to put let's say I can wave a magic wand and I could put a brand new large dentist in the most deprived and most needy part of Portsmouth tomorrow, I couldn't tell as I sit here now whether that's solving a local problem or whether the well-informed affluent that can travel are actually attending from, I don't know, pick your lovely part of the country to live in, Chichester, Winchester, New Forest could be travelling along, Perm, whatever you want to do, and attend. I don't know whether I've actually solved the problem. I can put what I think is the solution in place, but I can't tell at the minute whether I've solved the problem or not. Until we've got that real, much higher level of capacity where people are then deciding not to travel quite so far because the capacity is local to them, I'm not really assured currently, so we are pushing to get that data. We're starting to get some of it through, but I need it on a timely basis, and I need it better to know actually what I do is making the right things, and I'm not just seeing an increase in appointments being made.
Sarah and then Claire.
Yeah, I'm very conscious of time, but it would be remiss of me not to mention the word children in this conversation. I mean, we know that for the ages of children 6 to 10, the most common reason for attending hospital is around tooth caries. So we know that tooth decay is a critical element here, and that increases in areas of deprivation. I know, Simon, that you've done immense work. We know the impact of those mobile units that are being seen in the city But what more do we need to do for our vulnerable children in the city to ensure that their dental needs are met and that they're not ending up in hospital as a result of poor dental treatment?
Don't steal my thunder. So you're very... Yes, absolutely. I'm not going to disagree with that. What we are looking to do currently, and it is very early days, we have got the dental buses and they're going to, as I've said before, those areas that we need to. We are currently scoping out whether there are any fixed sites that Dentaid could go to carry on to provide that provision if it is local to where we need it to be, that will free up potentially those buses. If that happens, and it is an if at this point, I'm not going to promise anything currently, I would like to start to see if we can do an offer to schools around that. And Sarah's being naughty because I said I wasn't going to talk about this here, and she nudged me into it. I would like to scope out if we can start to bring buses to schools, see what that would look like. I think there are some challenges in that. I think a child is, particularly young children, are going to be, it's going to be difficult for them to consent, but I think if there is something around perhaps a video link to the parents that are able to consent, if it's not a massively invasive procedure, that the particularly when you're getting into the perhaps early teens, whether it's perhaps a checkup or even if it's the public health messaging, and we do commission something called Bright Bites from Dentaid, which is around actually going out to places and actually showing what it's a bit more than that supervised brushing, but it's explaining it and it's getting people to understand it, showing people how to do something. If they don't understand why they're doing it, you get that less engagement. If you start to explain to them why they're doing it and why they're doing it in that way, they start to bring into that. So you don't end up like, for example, a 57-year-old who has got a mouthful of horrors currently. So we don't end up in that place, and actually we then make best use of what capacity we do have. So yeah, we are. It is very much on the agenda. If, how, when are completely unknown at this point, but it is very much sorts of things that we are discussing and something that we want to do.
Claire.
I'll keep it brief, thank you. Natalie, the mouth I've heard is being used as a frame for the health of the mouth as a health represents the health of the body, so I couldn't agree more in terms of that sort of preventative message. But just to highlight on Helen's behalf, the oral health promotion programme, which is obviously in place, working with University of Portsmouth Dental Academy and Solent Special Care Dentistry, which of course is a sort of limited term programme, but really, and again to Sarah's point, working, in early years settings and so on. Also, just to note, Councillor Pitt, that we do have positive indications that there may be more of a national focus coming on oral health improvements, so useful to I think note in that space as well.
Thanks very much. Thank you so much, Simon, for presenting today. Some real challenges, but some real positives, and it's really good to hear about the fact that more people are seeing dentists in the city. And as Claire has said, so I know from say experience, especially from from when I was a sport worker, that mouth health is good for general health, and the facts of having a mouth full of decay and abscesses and things is just diabolical for the rest of the body health as well. So so it's really good to hear, and I'm sure we'll get another update from you at some point soon, and some really exciting stuff which might be coming down the line, especially with the schools. But I think those dental buses, I think they've made a massive difference as well. We've seen them on the TV news, and I think that 51?
51 visits from February to June.
Yeah.
So and we want to do as much as we can.
Yeah.
So anything that we can do to build that up. Actually, one thing I did forget to say at the point, so I will just jump in quickly, around the workforce. Dentaid are currently working on volunteer dentists. They are paid, but they are volunteer dentists. They are all on the performers list, which means they're qualified to work within the NHS. When I was asked in another similar meeting, another part of Hampshire, I was asked why can Dentaid get dentists and we can't. We asked the question back to Dentaid. How come you've got them? and it's because they don't have to go through the same contract. They're contracted in a different way, so they have that. It's not the money, it's not seeing patients in different areas of deprivation. It's about the working state that those dentists and that professional space they're working in, and the way we've contracted it opened it up a little bit.
Thanks, I really appreciate that, and yeah, I think that again is about why can't they use best practice in the general contract when, as Steve said earlier, a lot of things seem to be in arrested development from nearly 80 years ago, and we know this with GPs as well, which has been an ongoing thing. But really appreciate the update. Look forward to things progressing. And okay, and we'll move swiftly on now to the final item as we're nearly out of time. Portsmouth Community Pharmacist Summit, 6 months off. 6 months on. Over to Claire.
Thank you, and I'd like to bring in colleagues Joe Williams and Hinal Patel as well, who perhaps can introduce himself if I get started with just briefly summarising the paper. So the purpose of this paper is to update the board on work undertaken to support community pharmacies in the 6 months since the Portsmouth Community Pharmacy Summit held in November last year. So community pharmacy closures and consolidations were obviously noted at this board, which led to the summit being convened by Councillor Whittington and Councillor Vernon-Jackson. And the summit aimed to explore challenges and identify opportunities to support the sector given the pressures that had been experienced. Noting, of course, that pharmacy operates in a highly professional and regulated model, and therefore our actions locally about how we can better support within what we can do. The themes distilled from the summit were namely around 4 areas, so connecting with the health and care system, utilisation of local community pharmacy services, workforce and independent prescribers, and mental health and safety. So the paper summarised efforts in the last 6 months, which partners across the city have worked together on to support these areas. The initiatives have included working with Shaping Portsmouth on an innovative programme to support retail management and business development aspects of community pharmacy businesses, including community pharmacy and the No Excuse for Abuse campaign alongside GP practices, creating an innovative pathway with the University of Portsmouth pharmacy students to conduct blood pressure checks in community settings and then create that pathway into community pharmacies to utilise the service provision there, and in doing so also address inequalities, which is important from a public health point of view and for the city. Starting to think about how we review the locally commissioned services delivered by public health, and lots of ICB-led work, particularly around workforce, and of course implementing some of the national programmes which have actually occurred since the summit. So for instance, Pharmacy First, and Joe and Hinal may well want to comment further on those. It's important to note just finally that there have been no further closures or consolidations of pharmacies in the city in the 6 months since the summit. But having said that, we do obviously need to maintain our focus and support on community pharmacies in the city, not least because the national contracting arrangements are still expected, and also recognising the evolving role of community pharmacies in that primary healthcare space. So just finally, I'd like to take the opportunity to thank colleagues who have worked on this area, because it has been collective efforts of a range of partners across the city, and also invite Joe or Hinal to comment if they want to pick up anything further.
Thank you very much. Joe and Hinal, did you want to add anything to what Claire said?
Hi, Jo Williams, Deputy Director of Meds Optimisation, working locally in Portsmouth. So I've been working with our ICS workforce lead, particularly around the changes to the training year for our undergraduate pharmacists. So it means that on qualification from the year 25-26, you would become a prescriber, which is different to what's currently happening. So we've got an ICS pharmacy workforce and training group, and that's one of our priority areas that we're working on. There's an ICS multi-professional collaborative group, and that's looking at independent prescribing capacity across all postgraduate professions. The ICB have secured funding for community pharmacy supervision, so that's an essential element of the course in terms of doing the independent prescribing. So we've secured funding for community pharmacy supervision. in addition to gaining commitment from local NHS trust to support local community pharmacies with a supervision element in the training year. For 25-26, Portsmouth Meds Optimisation team will be offering 2 community pharmacy cross-sector training posts, which will also support the supervision element of the training year. And we've got the ICS workforce lead who's worked with the University of Winchester to develop a new pharmacist independent prescriber course, which has less face-to-face commitment, which is expected to be more attractive to community pharmacy.
Hi everyone, so I'm Henna and I'm Community Pharmacy Clinical Integration Lead, NHS Hampshire Isle of Wight. So I think since the summit happened in November, after the summit we had the national Pharmacy First service going live as of 31st of January this year. And clearly colleagues might know already that was a community pharmacist consultation service. So the new service, Pharmacy First, includes all elements of community pharmacist consultation service, plus additional 7 clinical pathway which community pharmacists can treat without the need of sending to the GP for onward treatment if antibiotics, antiviral or topical treatments were needed. So we were pleased to obviously able to roll out. So a lot of our work since the summit has been around mobilizing the service. We are pleased to say we have 100% coverage from our community pharmacy colleagues. So in light of Portsmouth, all the pharmacies in Portsmouth are providing the service. I think during the summit, it was very apparent that Portsmouth practices or general practices use System 1, which is very different to EMIS practices that we have across the rest of the ICB region. So we commissioned the System 1 licensing by which they are able to electronically refer patients into community pharmacy. The license were procured in March, and obviously we did online webinar as well as Q&A sessions, a toolkit to help practices to start using the system in terms of those referrals in. In the month of February alone, in the new 7 clinical pathway conditions for Portsmouth City, 700 patients were seen within those 7 conditions, which would have either been gone to general practice or any other urgent and emergency care. So that work still kind of carries on in terms of Pharmacy First. Obviously, my colleague Joe's mentioned around independent prescribing and obviously the workforce of community pharmacy coming. So there is a national independent pathfinder prescribing pilot that obviously we did discuss very briefly in Summit. As an ICB, we have 6 sites. One of them is in Portsmouth, which is just across the road from here. We haven't gone live because of obviously national issues or licensing, but as soon as that goes live, we will be closely monitoring the early evaluation and outcomes we are seeing, but working very closely then on with Simon's team on POD in terms of what does that prescribing workforce mean for us within the ICB. Clearly, there isn't any national commission services on it because I think we need to really understand the impact, obviously what value it brings, but also through different reports, especially the Health Watch one that has come out nationally recently, mentions around 74% of patients really want to visit their pharmacy at first base. So we are obviously eagerly waiting to go live on our Pathfinder and then to kind of build on any of those. But I think that's it, but we'll be happy to take any questions.
Thank you very much. Any comments or questions? As has been mentioned, I convened this summit with Councillor Jackson, and I'm really pleased with some of the progress that's been made. It's been absolutely fantastic. I think the System 1 bit, I know that was a really big issue about how they felt isolated from that, and so I'm really pleased that the licenses have been bought, and therefore we can do those farm refers in, which is incredibly positive because it just, and as just mentioned, 700 people using pharmacists rather than going through GP, I think is fantastic, and also linking in with that pharmacy first approach from elsewhere. I'm also really pleased with the work that's been done with Shaping Portsmouth, and from that business point of view, because one of the things that that was very evident when we started that, when we had that initial meeting before the summit itself, was how they weren't really involved in the business community at all. And that's the thing about our pharmacists. We have to remember they are retail businesses as well as being a really important part of our health and care system. So so I'm really pleased that those connections are being made, and also on that medical side as well, and just improving. And I really look forward to seeing how that further progresses, and again how some of that work that is going on at that national level and sort of can link in with our stuff in Portsmouth, and also for the wider Hampshire and Isle of Wight stuff. So we do have recommendations for this. So it's to note the collaborative efforts across many partners to support community pharmacies in the city through seeking to optimise existing services as well as implementing new initiatives, and note that continued efforts are needed to ensure a strong community pharmacy sector in the city. Is everyone happy with that? Brilliant. And I think it would be really good to have another report back in another 6 months, a year on, and we can see how further things have progressed. But yeah, as I say, I think it's been a really productive bit of work that we've been doing, and thank you so much everyone involved in it. So on to final item, which is just about dates and 2025 meetings, or 2024-25 meetings. Sorry, it will be, yes, on the 5th of March, 25th of June, 24th of September, and the 3rd of December, all Wednesdays at 10 AM, so that is for everyone to note. And thank you very much for everyone for coming today and all your contributions.